The first human tongue transplant takes place on July 19, 2003. During a 14-hour procedure, the 42-year-old patient's entire tongue was removed because there was a large malignant tumour, and the donor tongue was then attached to the blood supply and salvaged nerve endings. The Austrian doctors waited 3 days to make sure there were no complications and then announced the success of the operation to the world. The last piece of information that I could find about this particular surgery was that 8 months later the tongue had not been rejected by the patient's body and he had regained the ability to swallow saliva and small amounts of fluid, but he was unlikely to ever regain his sense of taste. Using a donor tongue, like in this operation, seems to be very rare, in part because the mouth is teeming with bacteria, so the need for immunosuppressants to prevent the body from rejecting the transplant can lead to serious infections. So most things called tongue transplants in the last couple of years seem to involve saving as much of the patient's tongue as possible and then using a graft of muscle from another part of their body. On the plus side, your body is less likely to reject the graft, but on the downside, you might wake up with a hairy tongue. Literally.